He was 65 years old, and on paper, he was the patient you don't worry about. No smoking, no family history, cooked every meal at home, exercised 3 times a week, and by every standard clinical marker, weight, cholesterol, blood pressure, he was doing everything right. But when I looked at his arterial imaging, it didn't match any of that. His arteries looked like those of a man 20 years older, inflamed, stiff, calcified in places. The kind of structural damage I associate with decades of very different choices. We sat together for a long time, going through everything: stress, sleep, genetics. Nothing explained it. And then, almost as an afterthought, the way people mention things they assume couldn't possibly matter, he told me that every night, without exception, he reheated his dinner. That was the thread. When we traced exactly what he was reheating and how often, the picture finally made sense. I'm Dr. Helen Sanders, cardiothoracic surgeon, 30 years in the operating room. And what I'm about to share is the conversation I wish I could have had with that man and with most of my patients long before they ever needed surgery. There are 5 common foods that go through a genuine chemical transformation when reheated. Not a subtle change, not just harder on your stomach, a transformation that, repeated daily over months and years, quietly accelerates the kind of chronic inflammation I have watched destroy arterial walls from the inside. Here's what makes this conversation different from most health content you'll find. None of these foods look dangerous. None of them feel like a risk. Some of them feel like exactly the right choice. In fact, one of the 5 is something a doctor may have specifically told you to eat more of for your heart, and reheating it may be doing harm that never gets traced back to the right source. Before this is over, you'll know exactly which 5 foods, what the chemistry does to each of them, why it hits differently after 60, and 5 specific changes you can make starting today. No prescription, no protocol, just a different relationship with timing and heat. If you've reheated any of these foods in the last week, and the odds are very high that you have, this matters more than you might expect. Before the 5 foods, I need 90 seconds of context. Without it, some of what follows will sound overstated. It isn't. Here's what changes after 60. Your body has always had the ability to neutralize damage: free radicals, low-grade toxins, minor inflammation. Your cells manage this constantly and automatically. In your 30s and 40s, that system is fast and reliable. After 60, it slows down across the board. Your liver processes toxins more slowly. Your immune response becomes less precisely calibrated. Your arterial walls are thinner and less elastic, and your cellular DNA repair mechanisms, the internal proofreaders that catch mutations before they become something serious, become less dependable. None of that makes you fragile, but it does shrink the margin. What your body absorbed without consequence at 40 carries more weight at 65. This is where chronic inflammation becomes the central issue. Short-term inflammation is your ally. It heals wounds, it fights infection. Chronic inflammation is different. Low-level, slow-burning, unrelenting, fed day after day by things that don't look like threats, things that look like dinner. Over time, chronic inflammation damages arterial walls, promotes plaque formation, and creates cellular conditions that elevate long-term risk in multiple directions. The cardiovascular disease and serious cellular illness I've seen most frequently in my career, in many cases, they share the same root. One note before we continue: everything here is general health information, not personal medical advice. Your situation is individual, and I always encourage working with your own doctor. But the chemistry is documented, the patterns are real, and this is worth knowing. The 5 foods all share one characteristic. When reheated, they produce compounds your body struggles to neutralize after 60, and the effects accumulate. Let's start with the one most likely in your fridge right now.
French fries, fried chicken, anything cooked in vegetable oil, sunflower, corn, soybean. You already know this isn't health food. What you probably don't know is that the first-time risk and the reheat risk are entirely different problems. When vegetable oils are heated the first time, they degrade, unavoidable. But when you take that oil-soaked food the next day and apply heat again, microwave, pan, oven, the oil undergoes a second round of oxidation, and that second round releases something far more concerning than the first: aldehydes, specifically compounds including acrolein and 4-hydroxynonenal, some of the same aldehyde compounds identified in cigarette smoke. Not in identical concentrations, not through the same exposure route, but through a similar oxidative process. Documented, not disputed. What do they do inside your body? First target, your arterial walls. They trigger oxidative stress. Picture the inside of a pipe slowly corroding. You can't see it from outside, but the cells lining your blood vessels are under attack. Over time, inflammation. The walls thicken, stiffen, lose elasticity. For someone over 60 whose arteries are already less flexible, this is a meaningful accelerant, one of the fastest dietary routes to elevated blood pressure. Then the second layer. Aldehydes are free radicals. They target the DNA inside your cells. Most of the time, your body repairs that damage. After 60, the repair system is slower and less reliable. Accumulated oxidative stress at the cellular level over years is one of the established pathways through which long-term cellular risk builds. Reducing it is among the most evidence-based strategies available. This is not about one plate of leftover fries. It's about the pattern. The same oil reheated week after week, the same oxidative insult quietly compounding. The fix: stop reheating fried food in oil or the microwave. Oven or air fryer at moderate heat, not high, cuts further oxidation significantly. Or eat it cold. Cold fried food doesn't trigger a second oxidative cycle. The goal isn't perfection, it's stopping the compounding. Now, the next food. This one frustrates me more than any other on this list, because the people it hurts are the ones trying hardest to do everything right. They're not cutting corners, they planned this, and they have no idea what happens after the pan cools down. Spinach, kale, Swiss chard, beet greens. If you're over 60 and paying attention to your health, someone with credentials has almost certainly told you to eat more of these. And they weren't wrong. Leafy greens are genuinely among the most nutrient-dense foods that exist. The problem doesn't start with the food. It starts with what happens after you cook it. Follow this sequence carefully. The order is everything. Raw spinach and kale contain nitrates, naturally occurring, largely harmless in their original state. When you cook leafy greens, those nitrates begin converting to nitrites. Normal, not yet alarming. But then the food cools. It sits. You reheat it. Heat causes nitrites to react with the food's proteins. That reaction produces nitrosamines. Nitrosamines are classified as probable human carcinogens by the World Health Organization, specifically linked to stomach, esophageal, and colorectal cancers. That's the WHO's own classification, not mine. And there is a cardiovascular dimension that almost never gets mentioned alongside that. Nitrosamines trigger direct vascular inflammation. They damage the endothelium, the living cellular lining of your blood vessels. The endothelium isn't a passive barrier. It actively regulates blood flow, pressure, and clotting. When it's under chronic attack, that regulation breaks down. Blood pressure becomes harder to control. Clot risk increases. So, probable carcinogen exposure plus active cardiovascular inflammation from a food cooked specifically with the intention of protecting your health. The people eating reheated spinach every morning are not being reckless. They planned this. They batch cooked on Sunday. They portioned it out. They reheated it each morning because they genuinely believed they were doing something protective. And the act of reheating is quietly working against everything they're working toward. That is exactly why this is worth knowing. The fix: cook only what you'll eat in one sitting. Leftovers go cold, salad, grain bowl, wrap, and never back into the microwave. Move cooked greens to the refrigerator within 30 minutes of cooling. Even 1 hour at room temperature accelerates the conversion enough to matter. You're not giving up leafy greens, you're simply changing the moment you stop heating them. Now, the next two foods have something in common that the first two don't. They both involve a window of time most people never think about, a gap between the kitchen counter and the refrigerator that seems harmless, and in that gap, something starts building that reheating later can't fix. Picture a Sunday afternoon. Large pot of rice, enough for the week. You put a lid on it, leave it on the counter while you eat and clean up. An hour passes, maybe 2. Into the fridge it goes. That window on the counter, that's where this begins. Cooking rice eliminates most bacteria, but one organism plays by entirely different rules. Bacillus cereus, a spore-forming bacterium, survives boiling. Its spores go dormant in the heat, and the moment the rice begins to cool, those spores activate and multiply rapidly. You made rice, the safest, plainest thing in your kitchen, and somehow this is the conversation we're having. Here's why. You think, I'll reheat it thoroughly. High heat kills bacteria. True, but reheating does not destroy the toxins the bacteria have already produced. Bacillus cereus releases heat-resistant toxins as it multiplies. Steam-hot rice, still active, still present. Short-term, nausea, vomiting, gastrointestinal distress. Unpleasant, but survivable. Here's what almost nobody talks about. Repeated exposure, 2, 3, 4 times a week over months and years, generates chronic intestinal inflammation, and that inflammation does not stay local. Think of the gut lining as a filter. After 60, that filter develops gaps. Inflammatory signals that used to stay contained now pass into the bloodstream and travel. The gut and cardiovascular system are connected through documented biological pathways. Disruptions to gut bacteria directly affect how your body metabolizes cholesterol and regulates blood pressure. This is not theoretical. It is supported across multiple independent research streams. After 60, your gut lining is more permeable than it was at 40. Toxins and inflammatory signals reach your cardiovascular system more easily. The barrier that used to absorb these insults quietly is simply not as strong. The fix is entirely about timing. Into the refrigerator within 1 hour of cooking, not 2, not 3, within 1. Used within 24 hours, reheated once only. Better still, smaller batches more frequently. Stop making 5-day-old rice work harder than it should. One honest question: how long does your cooked rice actually sit out before it goes in the fridge? If the real answer is more than an hour, that is the first habit to change. The next food brings a different kind of threat. It involves technology sitting in virtually every kitchen, a tool most people trust completely to make food safe. The problem is that trust is based on something the technology genuinely cannot deliver. Before I explain the microwave, I want to start where it matters most: what's happening inside your cardiovascular system. Every time your immune system encounters a bacterial pathogen, even a small amount, even an amount that causes no visible symptoms, it responds. Part of that response, cytokines, inflammatory signaling molecules that move into the bloodstream and activate a defensive response throughout the body. One exposure, your body handles it. You may feel nothing. Regular exposure, 3 or 4 times a week, cytokines circulating consistently, repeatedly activating your inflammatory response. And a repeatedly activated inflammatory response does the same thing to arteries every time. Damages the walls, promotes plaque formation, makes blood more prone to clotting. The slow arterial damage I see most often doesn't come from dramatic causes. It comes from small, repeated insults the body never fully recovers from between episodes. The inflammation never quite resolves before the next one starts it again. Now, why is the microwave the specific problem? Microwaves excite water molecules to generate heat. It sounds thorough. It isn't. The heating is uneven in ways you cannot see or feel. Food scientists call the unheated areas cold zones, regions inside a piece of chicken that receive little or no effective heat. The outside is hot, steam is rising. Inside those cold zones, the temperature may never reach what's needed to eliminate Salmonella, Campylobacter, or Listeria. Campylobacter survives temperatures that destroy most other foodborne pathogens. Listeria disproportionately affects people over 60. Its consequences can extend far beyond gastrointestinal illness to systemic infection. The gap between what you believe you're doing and what the microwave is actually delivering is invisible, and that invisibility is what makes it a genuine pattern risk. The fix? Oven with foil at moderate heat, more even, more reliable, more protective. Eating chicken cold in a salad or over vegetables is safe when it was properly cooked and promptly refrigerated. If the microwave is unavoidable, cut the chicken small before heating to reduce cold zone volume and rest it 2 full minutes after the microwave stops. Heat keeps redistributing during that window. That single change, oven instead of microwave, is one of the most protective adjustments you can make for your cardiovascular system this week. No cost, no special equipment, just a different appliance. One food left. I saved this one for last because it surprised me the most. Not one threat when reheated, 2, completely separate, through completely separate biological pathways, triggered simultaneously by the same action. Hold 2 things in your mind at once. First, acrylamide. When starchy foods, potatoes especially, are cooked at high temperatures, a reaction occurs between naturally present sugars and an amino acid called asparagine. The product is acrylamide. The International Agency for Research on Cancer classifies it as a probable human carcinogen, with research linking it to elevated risk of kidney, endometrial, and ovarian cancers. Here's what most people miss. Acrylamide forms the first time you cook a potato. When you reheat it, oven, air fryer, pan, more forms on top of what was already there. Each reheating cycle compounds the exposure. After 60, your liver's ability to clear acrylamide slows. The same exposure does more cumulative damage than it would have a decade earlier. The dose compounds differently now than it used to. That is threat one. Now hold that and watch what's happening simultaneously. When freshly cooked potatoes are allowed to cool, their starch structure changes. Resistant starch forms. It behaves like dietary fiber. It feeds beneficial gut bacteria, slows glucose absorption, and keeps blood sugar rising gradually rather than spiking sharply. A cold potato is measurably better for your metabolism than a hot one. This is not nutrition mythology. It's documented in glycemic research. But when you reheat that potato at high heat, the resistant starch converts back into regular, rapidly digestible starch. Blood sugar spikes, your pancreas surges insulin in response. For someone over 60 with any degree of insulin resistance, which is common with age, these repeated sharp fluctuations cause oxidative stress in vessel walls, accelerate arterial stiffening, and directly contribute to cardiovascular disease over time. One reheated potato, two simultaneous independent threats, both triggered by the same act. The solution is genuinely simple. Eat potatoes cold when you can. A cold potato salad dressed with olive oil, lemon juice, and herbs, resistant starch intact, blood sugar stable, acrylamide not compounding. If you need them warm, cook fresh at moderate heat. The cold potato isn't a compromise. After 60, it may be the smarter version of this food.
Now, I want to step back from the individual foods. Each one matters on its own, but what I actually see from 30 years of a very particular vantage point is what happens when 2, 3, or 4 of them are working against the same body simultaneously, quietly, every day, without the person ever suspecting it. Do you remember the man I told you about at the beginning? 67, no smoking, no family history, cooking at home every night, by every external measure, doing everything right. When we went through his actual daily habits, not the summary version, the granular version, the real routine, here's what emerged. Every morning, spinach in the microwave, a large batch made on Sunday, portioned out for the week, reheated each morning because spinach was healthy and he was being disciplined. Every evening, reheated rice, made twice a week in a large pot, left on the counter for an hour or two to cool, then refrigerated and microwaved for the next several nights. 3 to 4 nights a week, leftover chicken, microwaved, lean protein, home-cooked, no processed ingredients. He was proud of this habit. 3 of the 5 foods, every single day, for years. None of it felt dangerous. Every part of it felt right. That is the entire problem. No single meal caused what I saw on his imaging, no single month. It was the accumulated result of years of low-level, multi-directional inflammatory exposure on a body that no longer had the same reserve to absorb it quietly. Each of the 5 foods feeds the same process. Chronic systemic inflammation. Reheated oils drive oxidative stress into arterial walls. Nitrosamines from leafy greens directly inflame the vascular lining. Bacterial toxins from rice and chicken trigger repeated cytokine release that damages arteries incrementally over time. Compounding acrylamide and blood sugar spikes from potatoes add cellular and cardiovascular stress through separate but converging pathways. 5 tributaries, 1 river. And here is what I've watched that river do across 30 years of operating rooms. Arterial walls develop microscopic damage. The immune system sends cells to repair it. Those cells accumulate. Plaque forms. The arteries narrow. Blood pressure rises. The heart works harder against vessels that are increasingly stiff. the cycle accelerates. Simultaneously, cells throughout the body are under sustained oxidative stress. Accumulated damage over years is one of the established pathways through which serious cellular illness begins. After 60, the timeline compresses. Research suggests that diet-driven chronic inflammation, which might have taken 20 years to become clinically significant at 40, can become significant in roughly half that time at 65. Not because of failure, because the biological reserve has changed. Here is what I need you to hold alongside that. Diet-driven chronic inflammation is one of the most modifiable risk factors in medicine. It is reversible. Arterial function can improve. These processes can be slowed and, in some cases, meaningfully reversed, with consistent changes applied over weeks and months. I've seen it happen. Let me tell you what it actually looks like.
I've stood at an operating table with a person's chest open in front of me more times than I can count. And after enough years, the abstractions fall away completely. You stop talking about percentages. You stop referencing risk statistics. Because you are not looking at a statistic. You are looking at a 68-year-old grandfather, a retired teacher who walked 5 miles every morning for 20 years. A woman who cooked every meal from scratch for her entire adult life. And you're looking at their arteries, rigid, calcified, narrowed, holding in your hands the physical record of thousands of ordinary evenings and mornings that felt completely unremarkable in the moment they happened. The question that never leaves you, not during the procedure, not afterward, not years later, is: how much of this was preventable? The honest answer, based on everything I've seen and everything the research supports, a significant amount. Not all of it. Genetics matter. Age matters. There are factors no one controls, and I am not here to assign blame for damage that's already been done. But the patients I see most often who had no clear reason to be on my table, no smoking, no dramatic failures, no obvious explanation, they almost always carry the same quiet pattern. Reheated oils, microwaved greens, rice cooling on the counter, chicken from the microwave several nights a week. None of it looking like a health decision because none of it felt like one. That is the conversation I couldn't have before the procedure, only after the options had already narrowed. You are watching this before that, and I want to tell you something that is not reassurance, it's clinical reality. I have had patients who made exactly the kinds of changes I'm about to describe. Simple changes, timing, temperature, a different approach to leftovers, consistent over months. 6 months later, inflammatory markers measurably improved, blood pressure more stable. In several cases, imaging that looked meaningfully different in the right direction. Not cured, not dramatic, but real, documented progress from people who simply stopped feeding a fire that had been burning quietly in the background for years. The body you are living in after 60 has carried you further than you probably give it credit for. It has more capacity to recover than most people believe. Here's exactly how to give it the chance. 5 foods, 5 changes. None require giving up anything you enjoy, just a different relationship with when and how heat gets applied. Fried food. Stop reheating it in oil or the microwave. Oven or air fryer at moderate temperature prevents a second round of oxidation. Or eat it cold. Cold fried food doesn't start another oxidative cycle. Stop the compounding. Leafy greens. Cook only what you'll eat immediately. This is the biggest mindset shift on this list, especially if you've been batch cooking greens. Leftovers go cold. Salad, wrap, grain bowl. Never back into the microwave. Refrigerate within 30 minutes of cooling to slow nitrite conversion before it starts. You're not changing what you eat, you're changing when you stop heating it. Rice. The refrigerator within 1 hour of cooking, not 2, not 3. Used within 24 hours. Reheated once, never twice. If you can shift to smaller, more frequent batches rather than one large weekly pot, do it. Stop asking 5-day-old rice to be safe. Chicken. Oven with foil at moderate heat whenever possible. It heats evenly and reliably. Cold in a salad or over vegetables is safe and practical when properly cooked and stored. If the microwave is the only option, cut it small first. Rest it 2 full minutes after heating. That resting window matters. Potatoes. Cold potato salad with olive oil and lemon. Intact resistant starch. Blood sugar stable. Acrylamide not building. After 60, this is one of the most metabolically favorable versions of this food you can eat. If you need them warm, cook fresh, moderate heat, short time. These 5 changes stack. Each one, applied consistently, reduces your chronic inflammatory load. All 5 together, over weeks and months, produce changes you will feel. More stable energy, better blood pressure, improved digestion, less of the silent background damage we've been talking about. Your kitchen after 60 is one of the most powerful health tools you have. Now you know exactly how to use it. Which of these 5 changes surprised you most, and which one are you changing first? Leave your answer in the comments. I read them, and where people are surprised tells me what matters most to address next. If someone you care about is over 60 and reheating these foods regularly, share this video with them, not to alarm them, to give them what you now have. If this was useful, the like button helps more people over 60 find it when they need it. And subscribe. Take care of your heart. Take care of yourself. Everything discussed here is general health information only and is not a substitute for personal medical advice. Please consult your own qualified healthcare provider before making changes to your diet or health routine.